Okay,
This meeting is being recorded.
Adam,
Yes.
it's all yours now.
All right.
Would
give
you
me a
like
sec.
me to pull it up for you
Yeah,
and
that's
share
probably
it
a
for
good
you,
idea.
and you can just tell
Yeah.
me when you're okay? Let me find. Did the share button move here? Normally, I can pull this up quickly. One second. All right. Let me get the PowerPoint. Okay, can everybody see my screen?
Yes, I can see it.
Okay.
So I think you're going to want to advance to maybe slide 2 or 3. Here we go. Perfect. So this is, if you've been coming to these this summer, you know that we've done an occasional series on understanding your health plan documents. And this is a part of that series. This is about the denial letter, which is the document that probably is what gets you to give OHA a call or reach out to us. The denial letter is required by law for fully insured plans, for self-insured plans, which are regulated by ERISA, the federal law. It's required by regulation, and it's also required by Medicare and Medicare Advantage plans. A denial letter is when you either ask for a benefit or you ask to have a benefit reimbursed, and the administrator, the insurance company or the TPA tells you we're not going to pay for that. Next slide, so we can see the requirements. The requirements are very similar. I've sort of harmonized. The language is a little bit different, but the requirements for a denial letter are similar under all of the applicable laws. They have to identify the benefit, right? They have to tell you what, you are asking to have Dr. Smith perform this procedure on this date, sort of a thing. They have to provide sufficient information to let you know, to let you be able to make an informed judgment about whether to appeal. Right, so they have to tell you something about why they're denying it. We don't think it's medically necessary, or it's excluded from your coverage, or there are a handful of reasons why they why they might deny it, and they have to tell you what they are. And I personally feel like this is where a lot of denial letters that people get, and that I see the plans kind of fall down on this. They don't make it clear to people, this is what we're saying that we're doing. So if anybody from insurance watches this, the clarity and readability of the explanations, I think could be improved. When they provide that information, they're supposed to include the identifying clinical criteria, if relevant, or or the rule that they're applying, the policy, the law, the basis for why they're saying we don't think we should have to cover this or reimburse this. After they've done those things, they have to tell you what your appeal rights are. They and folks think it's sort of boilerplate, right? That if you disagree with this, you have the right to an appeal. You have to send a letter to such and such a place within some period of time. They have to make mention of the availability of assistance. So for plans that are regulated by the federal government, they'll mention that you can contact the different federal authorities, CMS, which regulates Medicare and Medicaid, or the Department of Labor, which regulates the ERISA plans. For state regulated plans, they have to mention that you can contact the insurance department. And also they mentioned that you can contact OHA, our office, which is the state designated consumer assistance program. Not every state has a consumer assistance program, but if you are lucky enough to live in Connecticut, then your state does, and the letter should mention that. And then they also include other required notifications, things like language access for people who don't speak English or don't read English and require a notification in another language. Next slide, please. So as I said, at a minimum, it has to tell you what's being denied. So that's this procedure by this provider that was requested or provided on a particular date. So that needs to appear somewhere early in the letter. You'll see that, and you can understand, especially if people are having a complex series of procedures or a hospital visit. Sometimes it can be hard to know what's being denied and what isn't. So this can help people to sort of parse out, well, they're covering the hospital, but they're saying that they don't have to cover Dr. Smith, or whatever the case may be. Next slide. They have to provide, as I said, sufficient information. So I've included a few of what I think are the common reasons why something was denied. They'll tell you, we don't think this is medically necessary. And what that means is that's a specific term of art for insurance, right? So your doctor may tell you, you need to have this done because, I think you need to have this done. And your insurance company may say, we don't think that's medically necessary, which doesn't mean it doesn't mean you shouldn't do it. It just means we're not going to pay for it. So a medical necessity denial, which is an awful lot of what OHA does, is based on the insurance company or the administrator applying clinical criteria that say, if you don't have these these things in your health background, these records, if you didn't present with, whatever conditions the criteria say, then this is not a covered treatment for you, even though your doctor may be saying that it is. And sometimes those clinical criteria are incorrect. Sometimes they are in need of updating. Sometimes we're able to argue that they don't include the totality of the circumstances, or that the person reviewing the claim simply missed in the records that, in fact, your blood pressure was this, or whatever the case may be. So we can approach those appeals by looking at the clinical criteria and and connecting the dots between the criteria and the person's medical record. Sometimes they'll deny for saying that a procedure or a treatment is experimental. And typically what that means is that they're saying there isn't yet enough history with this treatment to say that it could be covered for whatever it is that for whatever condition it is that you're talking about. Those appeals require a slightly different approach, which is to, maybe we find research that shows that, gee, this is something that's they've been using this procedure to treat this condition for decades, and the science is actually more clear than you, the insurance company, are saying. So that's a slightly different type of appeal. So it's important to sort of notice what they're saying when they're saying why this was denied. Sometimes a plan will deny coverage because a provider was out of network. We see a goodly number of those, or they will, and I didn't put this on here, but this is another one that occurs to me, that if there isn't a referral, from an in-network provider to a specialist. And that's in the case of plans that require a referral. Some treatments are only available in particular settings. So if you, and I'm struggling to think of an example, but if you're in a rehab facility and you're getting physical therapy, there may be, well, you couldn't also get home health at the same time as you're in inpatient rehab. It's not uncommon for an appeal to, or for a denial to come because they don't have enough information to approve it. And that's one where we would go to the provider and we would say, give us all the information. Let's make a complete claim out of this and see what happens. And sometimes people get a denial because their coverage has ended. If a provider, if they've changed plans, they've changed employers, but a provider is submitting claims to their old coverage, they haven't updated, then that can, the carrier that you're no longer with is under no obligation to pay those claims. So each of these different reasons requires a different approach, and that's why it's important to try to notice and figure out what it is they're actually saying. I think a lot of people, when they get a denial letter, they just, it's enraging and people become upset. But if you look at what they're describing, it can help you to understand how to work the problem. What information needs to be supplied, and how can we connect the dots between what the insurance company is saying and what you want. Next slide, please. The appeal rights are really important. This is, and not just because I'm a lawyer and lawyers live by deadlines, but the letter will tell you what level of appeals you still have. It'll tell you, so there are, typically you have at least one internal appeal. And an internal appeal is where you appeal to the insurance company. You say, hey, I think you got this wrong, and I want to give you a chance to fix it. Sometimes a plan will either give you or require you to make a second level appeal if you don't succeed in the first level appeal. They can convert. They will tell you when they've reached what's called a final internal determination, and that's where they're not going to hear any more appeals. They've, this is enough. Typically, that's after 2. Sometimes, if you don't submit a second, then their answer to the first appeal will become their final internal determination, and at that point, the insurance company or the TPA is not going to hear you anymore. You have to go to an outside source, and that could be, there's an organization within the Medicare program that hears those. It can be the insurance department does external appeals for plans that are regulated by the state of Connecticut. For ERISA plans, which are employer sponsored, at that point you have the right to sue the employer, and I don't think a lot of people do that, but that's where you go next after the administrator has washed their hands of the decision. They'll tell you if you think you need an expedited appeal, they'll give you information about how to request that. Typically, they want a doctor or a provider to support that, right? Because they don't give expedited appeals just because you would like an answer sooner. It's got to be because a medical professional thinks that you need an answer within 72 hours or something for health reasons. They will, you can always contact our office, the Office of the Healthcare Advocate, if you have any questions about these things. You can always contact us, and the appeal letter will tell you how to contact us and how to contact, or the denial letter, excuse me, will tell you how to contact us. They'll also tell you where to send the appeal. I think I skipped over that one. They'll give you the fax number, the email address, the mailing address that you have to use to get an answer to if you disagree with the denial. Next question. or next slide. So that covers denial letters. Now you know how to parse them and what to look for. But as the denial letters that you get are all going to say at the bottom, if you need assistance, please contact OHA. And if you're already here, it's because you know about OHA, and I love that and I appreciate that. Please share this information and share our information with people that you know who need help with dealing with and navigating these things, because as I say, it can be emotional to get these denial letters in, and our job is to be the professionals and to go to bat for you on getting these denials overturned. So please get in touch with us, share our contact information with all your friends. Thank you. And our contact information is on the next slide. And I thank you for coming. Please let me know if you have any questions. Anybody in the chat, Denise?
No, I don't see.
Okay.
Let me double check. No. So I'm gonna put our contact information in the chat as well. If you think of anything after. Oops, I don't know. It came out, the format's a little off. Otherwise, if there are no questions, everyone have a great day and thank you for coming.
Thank you.
Thanks,
Thank
everybody.
you.
Thank you very much.